So just be warned, like if you're at the dentist or orthodontist, like they are nosy. They're reading your text messages.
I'm your host, Ariana, and this is Hot Girls Have. Hello, and welcome back to Hot Girls Have. Have you ever wondered if tongue scrapers really work? Is mouth taping legit? Do you need a few tips on how to keep your teeth up as you get a little older? Today I'm talking to Dr. Sable Staller, an orthodontist based in NYC. We'll be talking about TikTok trends that actually work, your orthodontist recommended routine, products to ditch, and Dr. Staller's #1 tip. Welcome to the show.
Thank you. I'm so excited to be here.
Yay, we're
Hi,
so excited to
everyone.
have you. Okay, so let's start with the basics. Dentist versus orthodontist. What's the difference?
Yes. Okay. I just made TikTok video on this, but everyone seems to get a little confused on this. So I like to break it down very simple. Every orthodontist is a dentist, but not every dentist is an orthodontist.
Okay,
So
that's
to
simple.
So to be to be a dentist in general, you go to dental school, and then from there you can decide if you want to specialize. So once you finish dental school, you apply to residency. One of those is in orthodontics. So if you go on to do your orthodontic residency, that means that you become an orthodontist, and at that point, you only do braces and Invisalign, but you still have your dental degree.
Okay.
Now, dentists, they don't have to do that residency, and they can still do braces or Invisalign.
Gotcha.
They just don't have as much training. So they can still offer Invisalign. They do a great job. But the difference is orthodontists are only doing that, and they have a lot more training in it versus a general dentist. They do not.
Okay, so how often should you be seeing your dentist versus orthodontist?
Right. So for a dentist, every 6 months for a checkup. Your orthodontist, it's only if you want braces or Invisalign. So if you're interested in starting treatment, you can reach out to an orthodontist in your area. And then once you complete treatment and have your retainers, you don't really have to go back after that.
Let's be honest here. A lot of us stop wearing our retainers when we get a little older.
Yes.
So what are some options for adults like later in life if they maybe lost their retainer a couple years ago?
Right. Yeah. So
And if they don't have a permanent retainer.
Yes. So I see this all the time. Even if people have permanent retainers and they don't wear their clear retainers, sometimes their teeth still shift. So there's a lot of studies out there that show that your teeth continue to shift into your 40s. So even in your 20s and 30s, you can still get crowding in your lower teeth. Your teeth can still move. And a lot of people don't realize that. They think you wear your retainer until you're 20, 25, and it's fine. But your teeth can still shift. And one tidbit I want to give is a lot of times people will come in and they'll say, my wisdom teeth came in and it caused my teeth to shift. That's like the #1 line I get. And that's not true.
Really?
Yes.
Okay. So what is actually going on?
So a lot of dentists tell their patients this too, but in orthodontic residency, we learn that it doesn't cause that. There's a lot of studies showing it doesn't. So the way our mandible, our jaw is angled to our face, it causes your lower teeth to slowly drift forward. And our diet has changed over time, which has caused this to happen. So it may feel like it's happening when your wisdom teeth are coming in, but that's not the case.
Wait, what does diet have to do with it?
So just over time, our jaws from like 2,000, 3,000 years ago, even longer, they've shifted to become more angled just because of diet.
I thought you were saying that like because we drink more soda today or something like that.
No, I wish I would say
more
stop.
acai bowls or something.
Stop drinking soda and your teeth won't crowd. No, I wish. No, but it's just over time our bodies have evolved. Yeah.
Gotcha.
So to answer your question, what I would suggest is go to your orthodontist, or if you moved and you don't live near your original orthodontist, you can find someone online, go to them and say, hey, I stopped wearing my retainer and I need a new one. Now, if your teeth have shifted, what you can do is obviously go get a consult. Most orthodontists, they give free consults, and they can give you kind of a price on Invisalign, how much that will cost and how long it would take to straighten your teeth again. You can also get braces, adult braces. They're not embarrassing, I promise. People do have them if that's your only option. And there's also lingual braces, which are braces on the tongue side of your teeth. Those aren't
like on the inside?
On the inside, yeah.
Really cool.
Yeah, so they're custom made, and then they glue them onto the inside of your teeth. And then there's a custom wire that shifts your teeth accordingly to make them straight.
Whoa, is that a new thing? Or
It's
is
it's
that like
newer, yeah.
okay.
It's been around for a while, but I do see a lot more orthodontists using it.
Really?
Yeah, I will say the downside is it hurts your tongue a lot.
Oh, that makes sense.
Yeah, so your
That makes
tongue
sense.
is really scraping the
Uh-huh.
inside, so a lot of people don't like them or they switch. I think Carly Kloss got them one time. She lasted 3 days and got them off. This was a long time
Oh my
ago, but
god.
yeah, I think she just did Invisalign too. I'm,
Okay,
like,
fair.
weird like that and stalk all the celebrities.
I love that you know this. I mean, fair, that's important.
Yeah, yeah, so it 'cause it hurt her tongue, so I
Yeah.
vividly remember that, so it
So
stuck
do
with
you
me.
typically recommend that kind or not really?
No, just
Okay.
for that reason.
Yeah.
So Invisalign or regular braces, um, and to get your teeth straight again, and then you do have to wear your retainer. I always tell people nighttime for lifetime.
I do. I
Good.
do. I am proud to say I am a retainer wearer. I have always I not always, sometimes I skip a month here or there,
A month?
but my sister completely stopped wearing her retainer and now her teeth have started
Yeah.
crowding again.
Oh,
And I
no,
was like,
okay.
"Nope, I'm never getting braces again. I'm holding on to this like
Yes.
it's gold."
Well, you have beautiful teeth.
Thank you.
They look great. They're so pretty.
Thank you.
I will say if your sister, if she doesn't wanna do Invisalign, she could just go get a new retainer so they don't move more.
Oh, okay.
I think a lot of people don't realize that if you don't want to do anything right now, but your teeth are still moving, you can just go get a new retainer
That's
to
really good
just
to
hold
know.
them. Yeah.
So, what is one of the most common problems that you're seeing with adults right now?
I would say a lot of people that just stop wearing their retainers and their lower front teeth have crowding. And the only way to fix it is with Invisalign.
So, here's kind of a funny question for you.
Yeah.
I personally have always wondered this,
Yeah.
so I just felt like I needed to ask you this. So, I feel like whenever we go to the dentist or orthodontist, we're always kind of secretly worried that our dentist or orthodontist is judging our teeth.
Yes.
Is that a thing?
I don't think it is, but I mean, I feel like there's all personalities. So honestly,
Fair.
some may, but I try not to. And honestly, like people will say, "Oh, I just ate lunch," or "I just did this," and I see so many mouths a day, and I've seen some crazy things. I don't even notice if you have like food stuck between your teeth. So you shouldn't be as self conscious as I don't think you're making it a bigger deal than it is. Most
Okay,
dentists
fair.
and orthodontists, like, they don't even notice it. They're just looking straight at your teeth.
Fair. Okay. I just remember when I had braces when I was younger, I was in 10th grade in high
Yeah.
school and I was like the biggest like kiss up to my orthodontist.
Yes.
I was like always wearing everything that I needed to do.
Yes.
Like I would have the little like dental floss picks
Uh-huh.
and like just take such good care of my teeth because I was like my orthodontist is going to judge me if I'm not.
No.
So, okay, that's just like little high schooler
Yeah. I
thinking.
I will say if your teeth are really clean, I will usually make a comment because I'm like, "Oh, these look nice." Like, I've been seeing some crazy things all day, and so I do notice when they're very clean. But if they're not, I just let it go.
That's hilarious.
Or I'll tell you if you need to brush more. But I do have a lot of friends that are they'll be self-conscious, or if I meet someone and I tell them an orthodontist, they'll be like, "Oh my gosh, don't look at me." And I'm like, "I promise." I try to make a genuine effort to not look at people's teeth.
Do you do it subconsciously? Or like do you can genuinely like turn that part of your brain off?
No, I've like I feel like it's a developed skill now where if I tell someone I'm an orthodontist, I'm like, "Okay, don't look at their teeth,"
Oh
because
my god.
I can see them like panicking sometimes.
That is so funny.
Yeah.
So now I want to get into TikTok trends
Yes.
because I feel like there's a lot of trends that we need to either prove right or prove wrong.
Yes.
Because we got a lot of questions. So, okay, let's start with jaw training. There are all of these like weird devices that apparently you can wear to make you look more like snatched and
Yeah.
have like a more chiseled jaw. Tell me about that. I know mouth
Okay.
taping is one of those things. There's
Yeah.
like a bunch of weird devices. Like, what are your thoughts?
Yeah, so I did look up what is it called? The jaw training.
Mhm.
I looked that up on TikTok today because I hadn't necessarily heard of that or what you're referring to. I did find people are chewing on like a foam ball to strengthen their cheek muscles.
Mm-hmm.
Did you see that one on TikTok?
Mm-hmm.
Okay.
Totally.
I hadn't
And I
seen
was like, there's no way that works.
yeah,
There's
and
literally
I hadn't even seen that yet. I think because if I had, I'm like, that doesn't work, and I would
right.
just scroll. So I mean, it would work to make your cheeks chubbier, but it's not.
You're not gonna get snatched.
No, no. So, I mean, you know how all the celebrities are getting buccal fat pad removal?
Mm.
This would do the opposite. So you have something called masseter muscle on the side of your cheeks here, and it's your like the biggest muscle. When you bite on things, that's the
Mhm.
strongest muscle that brings your jaw back up. So if you're chewing on a foam ball to try to like snatch your chin, it's doing is building up that muscle, and it's just gonna make it thicker.
Oh yeah, because it's a muscle, so it's just
Yeah.
like the more you work it, the bigger it's gonna get.
Yes. So
Duh.
so you don't do that.
Okay,
It's
don't do
gonna
that.
do the opposite of what you want. Unless you want, little thicker cheeks,
Just
then
a
you
little,
can.
little something extra.
Yeah, if that's what you're going for, then do it.
So then, what about mouth taping?
Yes. So this is just a mouth taping is a huge topic in orthodontics, airway specialists, everyone. So it's more of a newer thing. They're trying to do more research on if it works or not. I will say I did have a course in ortho school where we kind of went over airway and mouth taping. And one of my professors, he mouth taped every night. He was dedicated to it. And all the other orthodontists were like, this is crazy.
Stop.
Yeah. And it was just funny because there were such different views on this. And so basically, it boils down to when you breathe through your nose, it helps filter out allergens and different particles when you breathe in. It also helps your body create nitric oxide that helps widen your blood vessels, which helps reduce your blood pressure. It helps reduce anxiety, things like that. And then versus if you're mouth breathing, it can cause cavities because your mouth gets really dry. It can cause sore throats. If you're already an adult and you are mouth breathing, it's not going to affect the jaw or necessarily the shape of your face. But when you're a kid, let's say 7 to 12 and you're mouth breathing, what can happen is your jaw and your face is still developing. So you're going to start to develop a longer face. Your maxillary arch, your top teeth, they're going to be narrower. And you're going to have usually what I see is an open bite in the front where your top teeth don't cover each other. Your top and bottom teeth don't cover each other. Because as your jaw is growing, it's becoming elongated from mouth breathing. So if you have a kid who's mouth breathing, I would say it could be because adenoids, if you have an issue with your tonsils, it could be they may have sleep apnea, or for some reason they have a crossbite that's causing them to have an open bite. I would say go see an ENT or an orthodontist to try to correct it because once you're fully grown, you're going to have that long face and there's
Yeah.
nothing you can do about it.
So really, mouth taping might only be necessary for younger kids,
Yes. So there's no research that proves
unless like your professor.
yeah, unless my professor was just living, he was 80 years old, just living his best life, mouth taping. Him and his wife did it every night.
I love that. Okay, so it sounds like it's not fully research backed yet.
No, there's no study that 100% proves that it can increase your health and wellness. Now, I do see things on the internet all the time that say to do it, but I would say if you do mouth breathe, then there's something else going on. Either you have sleep apnea, you have a bite issue, or you have a tonsil issue, and you need to figure that out first, instead of mouth taping to solve it.
Good to know.
Yeah, but you could try it if you want. I do have a funny story. My best friend from dental school, her husband, they're both dentists, but he started mouth taping because he was seeing it online too, just to see. And he has really small nose, so his nostrils are really tiny, and he couldn't breathe. Like he would wake up gasping for air, so he had to stop doing it. Yeah, it was pretty funny. He has a very small nose.
Oh my gosh. Yeah, that sounds like pretty rough.
Yeah.
Next, I want to talk about bad breath.
Okay.
I've seen a lot of videos about tongue scraping.
Yes.
Does it work? Is it legit? Does it help with breath? Like,
Yeah. So
should I go buy a tongue scraper?
You should. I love this
should.
trend. Yeah.
Oh,
We have a
really?
green light for this trend.
Okay.
So it's great. The bacteria that usually causes bad breath is really harbored on the tongue. So if you wake up and you tongue scrape, it's gonna help get rid of the bacteria that causes bad breath. And it can help, just reduce the bacterial load in your mouth to help fight sickness.
When I'm brushing my teeth, can I just tongue scrape with my toothbrush?
Yeah, you can. That's
Oh,
totally
okay.
fine. Yeah. You can, if you just brush your tongue, it's the same thing basically. You don't need
Because I saw a $50 tongue scraper online, and I was like,
No.
please tell me this is not the thing that is going to help me.
Yeah, don't go buy that.
Okay.
I do have a tongue scraper. It's just a metal one. I bought it on Amazon for $7.
Okay.
I also looked somewhere. I think the tongue scraping industry, this company, I don't know who sent this to me, but they made like $1 million off of tongue scrapers on Amazon. So don't get fooled. Don't buy a $50 one.
Oh my god.
Just buy, if you really want one, just buy a $7 one or
Okay.
just brush your tongue. It'll do the same thing. So if you have bad breath and you've tried the tongue scraping and it doesn't work, it doesn't help, you can get TheraBreath mouthwash, and it's specifically made to help target bad breath and fight the bacteria that cause bad breath, because there's different bacteria for bad breath, cavities, things like that. So their formula is really good for that. So that's something else you could get if you're tongue scraping and it's not working. Go try that out. You can get it literally anywhere.
Okay, love. Actually, I
Yeah.
think I've tried that before.
The TheraBreath?
Yeah.
Yeah.
Yeah, it was big on TikTok at one point.
Yes, yeah.
And I totally bought it.
Yeah.
I liked it. It tasted like good.
Yeah.
Sometimes their like mouthwashes are really spicy, but it was good.
Yeah, it's good. It is a little different, but
Yes.
I will say, yeah, you don't know if that's actually like valid or not when you see it
Right.
on TikTok, but it does work.
Okay, good to
Yeah, so I don't use it. It's expensive.
Yes.
It's like $13.
I
or
ran out and
something.
I was like, sorry.
Yeah.
No more mouthwash.
Yes, that's very expensive. So just buy a tongue scraper.
Yeah, okay, perfect. So next, let's talk about your favorite whitening products. So I
Yeah.
know you've mentioned that yours is the Crest Fluoride mouthwash.
Uh-huh.
What do you think about whitening strips? Like, is this basically the same thing?
Yeah.
Because everybody says everybody has a different hack for
So many.
whitening teeth. There's
Yeah.
like those weird LED things that you can put in your mouth.
Yes.
There's a million things out there.
Yeah, there's so many things. I also see so many influencers post about teeth whitening, and I'm
Yeah.
just like, no, not this again. So I do love the whitening mouthwash. I would say it's more for not if you want to make your teeth more white, but just to keep things where they're at.
Okay.
I usually use the Crest White mouthwash in the morning, and what it does, it just takes off stains that have built up from the day before. I really do think that works. I bought it randomly and I started using it, and I really did notice a difference. And
Your teeth are gorgeous.
thanks. I was honestly shocked too. I wasn't expecting it to work. I'm like, okay, well now I need to tell everyone. So it really did work. And I'm also just a Crest White stan in general. I think it's a great product.
Mhm.
So I love the Crest White strips. I think they work great. Basically, for you to whiten your teeth, you have to have peroxide in the material. So either hydrogen peroxide or carbamide peroxide. If it doesn't have that, it's not going to effectively whiten your teeth, even though it says it will. Don't trust it. It doesn't work. Okay.
Good to know.
Yeah. So look for those two things. If you're going to do any sort of whitening at home, at the dentist, they'll have the correct one at the dentist. But you need to have peroxide in there.
So what about the like charcoal based toothpastes?
Yes. Though we love those. No, we don't.
Are we done?
I even had one of my dental assistants bought the purple toothpaste the other day,
Yeah.
and I was like, "Why didn't you ask me before you bought that?" It was like $30.
And
Like,
it doesn't work?
it doesn't work. No.
Okay.
So especially the charcoal toothpaste, it makes your teeth more white. It does do that. I will say that, but it does it by it has particles in it that are abrasive, and when you brush it on your teeth, it takes off the top layer of enamel and the stains, so it makes your teeth look more white in the moment. So that is true.
Oh.
But
then you're literally scraping your teeth.
yeah, so over time, like let's say if someone for some reason used that every day for 10 years, your teeth, you're going to have barely any enamel left, and your teeth are going to end up yellow because the dentin that's underneath your enamel is more yellow.
Right.
And so as you scrape off the surface, it just gets your teeth over time become more yellow. So
Okay, so recap. No charcoal toothpaste.
yes,
No purple toothpaste.
no.
No those LED weird things that are on those.
Yeah, the LED lights, they may work a little bit, but again, if you don't have peroxide, then
Okay.
it doesn't do much. Yeah.
Okay.
Yeah.
It's easy to remember.
Yeah.
Next up, I want to get personal.
Okay.
Let's talk about some of the craziest things you've seen in your office.
Oh gosh. Okay. I'm nervous.
What are some crazy stories?
Oh gosh.
Hit us with anything.
At work, I'm trying to think. I will say a lot. I don't have a specific story, but a lot of people will text on their phone. They'll either text about me or they'll be like rage texting about a story to one of their friends, and I can see everything, but I act like I can't because I'm not like.
What
What
are
am
they
I
saying
supposed to
about
say?
you?
But sometimes, like if I'm taking too long or we're behind, they'll be like, "I'm still here. This is taking so long." Like, which isn't rude, but I'm just like, I can read this. Or they'll be like, "Oh, she hasn't gotten to me yet." And then, like, I can see it when I sit down.
Right.
So just be warned, like, if you're at the dentist or orthodontist, like, they are nosy. They're reading your text messages.
Stop.
I
Okay,
don't I
God.
think it's the angle. People think we can't see it,
Uh-huh.
but we have good eyesight. We can see
Yeah,
what's
you're
going on.
human. Oh my
Yeah.
gosh. Okay, that's
So,
funny.
yeah, that's been pretty funny.
Are there any like crazy situations with teeth that have happened in your office?
With teeth?
Either like a crazy transformation that you've helped with, or maybe somebody's come in and you've been like, "Wow, you need some help," or something.
I did have someone one time ask me after she got her braces, how intimate she could be with her boyfriend.
Stop.
Yeah.
Yeah, that one's pretty awkward.
Yeah,
I
it
would
was.
like, Google that one,
Yeah.
honey.
It's just like, do you.
Yep, go for it. I support.
Yeah.
Okay, so you are very big on social media. I want to know, what is one of the funniest orthodontist reacts videos you've commented on?
Yeah, so I see a lot of videos of people doing at-home braces where they'll literally so you
You're
can
kidding.
yeah.
How do you can't. That's not a thing. What?
Yeah. Well, so in other countries, it's actually really common. You can go buy braces just at the convenience store, which you can't do here, but you can order them online for yourself.
Oh.
Yeah. So they'll literally they'll glue the braces on themselves, or someone in the community will do it for their friends. And then they'll put the wire in, attach everything, and try to do braces themselves. And then
DIY
yeah,
braces.
yes.
Okay.
And then they'll post the transformation and then they take them off. And all the comments are like, "How are you going to get the glue off?"
Oh yeah.
So I don't know how they're getting the glue off. I don't know if they're just going to their dentist and saying, I didn't ever get the glue off from my orthodontist. Can you take it off?" Like, I really don't know, but it's crazy. Don't do that, by the way.
Okay, yeah, no. That's one DIY project that I don't think I could
Yeah.
do. No chance. That's really funny.
Yeah, they are interesting to watch because I'm like, what's going to happen?
Yeah, seriously. Huh. Let's hear your personal nighttime routine. Like, tell us products you use, the order of things, etc. I know that you're not supposed to wash your face until after you brush your teeth because you could get like toothpaste or something on you.
Yes.
And that's like a whole thing.
Yes, I actually did see that recently and never thought about it. So I stopped washing my face until I brushed my teeth. I think I heard a dermatologist say that on there, which is really smart. Yeah.
Right?
Yeah, because the fluoride can cause contact dermatitis, I believe, or something like that.
I didn't know that.
Yeah.
I just knew that my face was always like kind of red if I woke up in the morning.
Yeah. So yeah, wash your face after. But I'll do my tooth routine. So if you want to do the full thing, the full shebang,
Yeah, let's hear it.
floss and then water flosser and then mouthwash and then brush your teeth and then tongue scraper.
So which mouthwash? The Crest one?
So
Fluoride?
I use that in the morning, but at nighttime I like to use the ACT mouthwash, ACT. I use the green one. It has fluoride. It doesn't have any alcohol, and it's really good for your teeth, especially if you tend to get cavities. And then for floss, just make sure you don't use a floss with wax in it, because the wax, there's studies coming out, which it's hard to pinpoint this exactly because there's so many different factors in the body, but the wax is getting into the bloodstream. So a lot of dentists are telling patients stop using waxed floss. So that's a
Oh,
good tip.
that's really good to know. Okay.
Yeah.
Now I need to check on my floss.
Yeah.
There's wax.
Yeah.
Okay.
Yeah.
And then the toothpaste.
Yes,
kind of
I
toothpaste?
loved Sensodyne toothpaste.
Oh,
It's my
okay.
favorite. Yeah.
Cool.
It has fluoride, and then the properties in it help prevent tooth sensitivity. And my teeth tend to get a little sensitive, so I think that really helps. I tell all patients to use it if you have sensitive teeth, or if not, it's still a great one to use.
And then you tongue scrape last.
Yes. Just because I don't like the way so when you brush your teeth, you shouldn't rinse your mouth out with water afterwards because you're washing away the fluoride in the toothpaste. So there's like toothpaste on my tongue, so I like to tongue scrape afterwards.
So what are some products that you think people need to ditch altogether that either are big right now or were big at one point?
Okay. I would say whitening pens. I don't think they work.
Okay. I've
Um,
never used one. Actually.
yeah, you
They
don't
just kind of look a little sketchy to me. Like,
It's just weird,
how can
right?
that tiny little pin do all that?
Right?
I don't know.
Like it can't actually work. Well, it
Yeah.
doesn't really work. So
Okay.
just ditch that. Don't buy it.
Okay.
charcoal toothpaste, ditch it. Also whitening toothpaste because it has the same thing. It has abrasive properties, and that's what it's whitening your teeth. So get rid of your whitening toothpaste. Stick to toothpaste that doesn't say extra whitening.
Mhm.
Um, if you want to just really break it down, all you need is a manual toothbrush and floss, and that's it. If you want to keep it simple and bare bones.
Oh yeah, wait. Also, what do you think of electric toothbrushes?
Yeah. So
That's a good point.
I love them. I think they work
You do?
great.
Okay.
Yeah. A lot of people use them incorrectly. So you are supposed to just hold them on each tooth and let them do the work. A lot of people use their electric toothbrush and then just scrape back and forth,
Yeah.
which is not correct. You might as well just get a
I've
normal
never
toothbrush.
had an electric toothbrush.
Oh, really?
Yeah, I
Oh.
don't know why. I called me old fashioned, but I like me a normal toothbrush.
Wow, I love
But
that.
okay, so they work.
Yes.
Okay.
Not all of them work. There are some that don't. So I love Sonicare and I love Oral-B. I think those are both great. There's a ton of studies that show that they work.
How often should you be switching out your toothbrush?
The rule of thumb is every 3 months.
No.
Yeah.
3 months?
Yeah.
I have not changed mine in way longer than
Honestly,
that.
I don't think I have either.
Oh my gosh. Okay, 3 months.
Yeah. Or if you're sick, change it after you're sick
Oh.
because of bacteria.
I usually just throw mine in the dishwasher.
You put your toothbrush in the dishwasher? Is that real? Doesn't it melt? No?
I actually
Wow.
put my toothbrush in the dishwasher after I'm sick.
That's a great hack, but also, like, aren't they like $3? I mean, I love that for you. I'm gonna go try that.
I don't know. You should. They're like $3. They're
Wow.
cheap now.
I have chills. I'm just shocked.
I didn't even think that it would melt. Whoops.
Wow. No, I'm gonna go try that.
Do it. I mean, it works. I don't ever get sick twice.
Yeah. Everyone go try that at home. Don't get mad at us if it ruins your dishwasher.
Your dishwasher, sorry. Okay, wait. Straws. I know straws are important.
Yes.
Stains on teeth,
Uh-huh.
right? We stand with straws.
Yeah.
We love straws. If I have a hot coffee,
Uh-huh.
I'm not about to drink that with a straw.
Yeah.
What do you do?
Yeah, I love straws. I drink everything with a straw. It's like I carry straws with me. So I make this is embarrassing. I make hot coffee in the morning and then I just throw ice in it and then chug it with a straw. It's gross. It's disgusting. But because I don't want to drink hot coffee, it's gonna
Yep.
stain my teeth.
Yep.
So I would say if you have to drink hot coffee, because a lot of people like it, makes you feel warm and fuzzy inside. You can try, as long as it's not too hot when you drink it, you just need to bypass the front teeth. So if you
Okay.
can kind of drink it and get it to go to the back of your mouth
Mhm.
and swallow, then I would say that's my number one tip for that.
That's tough.
Yeah.
That takes some skill.
Yeah. And like, I don't know if you would do that in public. It's going to take it's going to look weird.
Something my dentist told me
Mhm.
was whenever I would drink hot coffee to just brush my teeth right after,
Uh-huh.
and then I would be fine.
Yeah. So that's a good
If
recommendation.
you can't, if you just can't get it iced, you got to get it hot.
Yeah.
Then just like I would just go to the bathroom really quickly, bring
Uh-huh.
like a little tiny toothbrush with
Yeah.
me, and like that was my compromise.
Yeah, no, I think that's great. A few things. Drink your coffee quick. So give yourself like a 30 to an hour minute window where you're drinking your coffee. And then after that, when you're done, you want to wait 45 minutes because coffee is acidic. So if you brush your teeth right away, the acid's going to still be in your mouth and it's going to be exposed to the fresh enamel since you just brushed it. So that can actually erode your teeth. So
no.
yeah, so you want to try to wait 45 minutes
Okay.
and then brush your teeth.
Okay.
Just swish with water while you wait,
Mhm.
but it's actually better to wait a little bit before you brush.
We love ending every episode with one takeaway that listeners can drop in their group chats. What is yours?
Yes. Okay. So hot girls floss. Okay.
Hot girls floss. Yes.
Yeah. So I've seen a lot of mouths. I've seen a lot of patients, older and younger, and a lot of people, they get something called a black triangle in their teeth, which is where if the bone recedes in between your teeth, the gum kind of follows it and it can create a space there, even though there's not a space between your teeth. There's an extra space where that bone has receded. And there's not a ton you can do to fix that. You can
Right.
try to get a gum graft. You can try to get a white filling in there, but that's hard for the dentist to do. You could get veneers, but that's going to cost a
That's
lot
a
of
whole
money.
process too.
Yeah, it's a whole thing.
Just floss.
So just floss. It's going to help prevent bone loss. And that's when you look at yourself in 30, 40 years, you're going to be so thankful that you did, because that's the only thing that's going to prevent that from happening. So
Wait.
hot girls floss.
Well, Sable, thank you so much for joining us on today's episode. This was so fun.
Thank you. I had a great time. It was great. I love you guys. Yay, wow, thank you.
Thank you so much for joining us on today's episode of Hot Girls Have. You can find anything we mentioned in our show notes. Want more? Visit our website or check out our social media. This podcast is brought to you by Belly Welly, leading the charge in women's gut health.